one of the reasons why the program is so effective is because of the social interaction in the groups. The groups create this sense of social support and friendship that drives motivation and behavior change of the patients. And so I previously thought that, the idea of a group visit was crazy and we should just stick with one-on-one visits. But really the science shows that groups provide this amazing sense of social support that provides a lot of benefit to the participants.
Welcome to 20-Minute Leaders. Just sit back, relax, and learn from the leaders of today. It's a journey. Each one is different, unique, inspiring. Let's get started. This episode is powered by J Ventures, a community-driven VC fund in Silicon Valley, in partnership with Lomitech, and sponsored by Homeward Ventures, Hippo Insurance, Upwest, Hillel at Stanford, Leap, and Birthright Excel, and in media partnership with CTech. Welcome to 20-Minute Leaders. Meet Laurence Girard, Chief Executive Officer of Fruit Street Health. Laurence is the CEO and founder of Fruit Street Health, which is a telehealth company that delivers the CDC's diabetes prevention program via live group video visits on Zoom with registered dietitians. He has raised more than $25 million in funding for the company via crowdfunding for more than 500 physician investors. Laurence completed his bachelor's degree at the Harvard Extension School and was recently accepted to the program for leadership development at Harvard Business School. While Laurence was originally planning to go to medical school, he decided to pursue a career using technology and entrepreneurship to have a social impact on public health. Laurence Girard, welcome to 20-Minute Leaders. How are you?
Good. How are you?
I'm doing great. Thank you very, very much for joining me here. I'm really excited to talk to you about the founding story of Fruit Street Health, as well as the impact that you're having. You're working with the CDC's diabetes prevention program. You've fundraised more than $25 million, but you've done it in a pretty unique way with more than 500 physicians. And so we're going to have a lot of fun talking about it and talking about your own personal journey. But what I would really love to start with is the fact that you wrote thousands of articles for Yahoo in high school in order to pay for your car. And I have seen a lot of fun facts for this show. This is one of the most fun of all. So tell me a little bit about this entrepreneurial story.
Yeah, well, my dad was always a copywriter, and I had kind of gotten interested in writing in eighth grade, and just needed a way to pay for my car to go to soccer, and basically just learned about these websites like Associated Content and Demand Media and whatnot, and these companies would pay you $2, $5, $10 an article to write these 400-word articles about really random things. It could be about facts about the monarch butterfly, or I wrote an article about the rules for the FIFA World Cup that ended up getting featured, where I got like a $500 royalty payment as well. But I actually had a professional copy editor when I was in high school. And so I became a very good writer, which is an essential life skill to be able to, write well and coherently and get your writing criticized. So I have written thousands of articles about very random topics and just became a very good writer in high school as a result of that.
What are some memorable topics that you remember that are perhaps the most non-trivial of all?
Certainly when I wrote that article about the FIFA World Cup and I randomly got I think it was like a $400 payment in my PayPal account, I didn't understand why, and it was on the homepage of Yahoo's Associated Content a year after I wrote it. So that was probably the most memorable. I also, certainly there's a bunch of very obscure topics about like facts about the eukaryotic kingdom and, articles about hotels and random cities and, they even paid me $15 once to write an article about how to tie your shoes. So it's very every topic under the sun that you could imagine.
Well, I can only imagine. I don't even know how to describe in words, in written language, how to tie a shoe. So I think that definitely an interesting variety. So tell me, Laurence, how you got started with Fruit Street Health, and what is the problem sort of that you attempted to solve, and how you're very creatively finding a way to solve that problem?
Yeah, well, in high school, I was always interested in diet and exercise because I was actually pursuing professional soccer in high school. So I had played for the New York Red Bulls Academy team as a goalkeeper when I was 18. But at the time, I decided that instead of pursuing soccer, I wanted to focus on something with more of a social impact and go to medical school. And so the year after I graduated from high school, I started volunteering in my local emergency room in the North Shore LIJ system. And while I was doing that, I also took a nutrition epidemiology course with a Harvard School of Public Health professor. And I realized that I was probably the only person that has ever taken a nutrition epidemiology course while working in an emergency room, because they're polar opposites.
Wow.
One focuses on prevention and one's treatment. And, one day there was this man that came in that had passed away purely due to his obesity, and he had a heart attack. And I was in the room when it happened. And I just realized that this was preventable. So I became very interested in lifestyle modification and public health, learning about physicians like Dean Ornish, who proved you could reverse heart disease through diet and lifestyle. And then basically moved to Boston and started this as a summer project at the Harvard Innovation Lab on the business school campus. And that was when I was in the bachelor's degree program at the Harvard Extension School. And basically, I just got interested in this idea of using technology and entrepreneurship to have a social impact in healthcare, and had some local physicians invest in the company, which is where the name Fruit Street comes from. It's the address of Massachusetts General Hospital, and the rest is history. But the specific problem we're solving is that 1 in 3 U.S. adults are pre-diabetic, which means they have elevated blood glucose and they have a high risk for developing type 2 diabetes. And so this program that we have, this diabetes prevention program, is designed to help them lose 5 to 7% of their weight through diet and lifestyle, to help them avoid developing type 2 diabetes. And so that's the problem that we're focused on.
And so that is the problem. And obviously, the dissemination of information is probably the most critical piece here, and explainability and understanding. So how do you actually go about in doing that in an innovative way?
Yeah. So, the history of it's interesting. 20 years ago, Medicare had spent about $175 million on a clinical trial where they enrolled about 3,000 patients with prediabetes into this program. And they compared a lifestyle modification program to a pharmaceutical drug, metformin. And what they found was that the lifestyle program was more effective than metformin in preventing type 2 diabetes. And that research was published in the New England Journal of Medicine. And so the lifestyle group had reduced their risk for type 2 diabetes by 58%. And so most of the diabetes prevention programs around the country are in-person programs at churches, hospitals, and YMCAs. The way we deliver it is online through telehealth and a live group video conferencing on Zoom with registered dietitians. And so if you can imagine one dietitian and 30 patients video conferencing on Zoom from either their computer or the Fruit Street mobile app, that's how we deliver the program. And then we also issue them a wireless scale and a Fitbit so they can track their weight loss and physical activity. And they can also take pictures of their food in our mobile app and get feedback from the dietitian. So that's the product. And today we sell it to large self-insured employers and health plans, but we're also rolling it out as a direct-to-consumer product as well. And physicians will soon be able to refer patients to the program as well. And so there's a variety of ways to kind of educate the public and enroll them into the program.
So take me back to the decision to get the funding from hundreds of physicians instead of the traditional, venture capital model or venture debt model. Why go through this route?
Yeah, I think that in healthcare, it's difficult to be exclusively focused on profit, and you have to have a hybrid approach of wanting to have a social impact and have a sustainable business model. And I think often private equity is exclusively focused on the financial returns rather than the mindset of a doctor, which is more focused on a combination of having a social impact and having a sustainable business model. And so we had made this conscious decision that we wanted this to be more of a grassroots effort of physicians and individuals who wanted to have a social impact in healthcare. And there's a lot of benefits of this. So we do have 500 physicians as investors, but they also participate in an advisory board through software called Basecamp, where they give their feedback and input into different things like the software design, the business model, clinical guidelines. They'll introduce us to colleagues who might be interested in referring patients. They'll also introduce us to potential customers as well. And so we're kind of like crowdfunding the capital for the company, but also crowdsourcing knowledge for the company, and then building a network of evangelists who can promote the company I saw a quote from the CEO of AngelList recently. I think it was that angel investors and venture capitalists provide expertise, but crowdfunding creates fans and customers. I thought that was an interesting one.
I love it. Okay, and what have you learned from the enablement of getting these these programs and these educational programs and the monitoring and the whole shebang online? So obviously it's a very different experience than getting it in person. You're doing it at scale. What have you learned about diabetes prevention and education through Fruit Street Health?
Yeah, I think that the pandemic has helped everyone to realize that telehealth is here to stay and that it's very convenient and easy to use. There was a lot of people that were skeptical previously, but really the pandemic has caused this monumental shift in telehealth adoption, and that we've realized that doing a group video visit on Zoom can be very similar to the experience you'd have in person. I think one of the most surprising things for me was that one of the reasons why the program is so effective is because of the social interaction in the groups. The groups create this sense of social support and friendship that drives motivation and behavior change of the patients. And so I previously thought that, the idea of a group visit was crazy and we should just stick with one-on-one visits. But really the science shows that groups provide this amazing sense of social support that provides a lot of benefit to the participants.
Right. That makes a lot of sense. And so if you were to look at taking this example and extrapolate from the model that you've built and the lessons that you've learned, where else do you think we can apply a similar tactic to improve the lives of many people at scale?
Yeah, there's actually many chronic disease management programs that use groups in person that are evidence-based programs that are highly effective. For example, there are smoking cessation programs. There's well-known programs like Alcoholics Anonymous. There's programs for patients that already have type 2 diabetes. And so we're considering in the future taking this software infrastructure we've built for group visits and applying it to other diseases to bring these programs online through Zoom, which we've all become so accustomed to during the pandemic. And so I think that groups could almost be applied to any chronic disease because, again, it provides a sense of social support. You're going through a program with other patients that are experiencing the same thing as you. And that's very powerful.
Right. I think that makes a lot of sense. And if you're looking at your own journey and, now from more from a leadership perspective, what is it like running a company that is funded by so many people, that is impacting so many people? Where do you find yourself in the midst of all of this interaction? What is your role, your responsibility, whose commitment are you going towards?
Yeah. Well, my bad joke would be that my job is fundraising and hiring smart people, because at this stage, if you're doing everything yourself as the CEO, you are guaranteed to fail. And so I really think it's about, building a team of people that can execute and removing yourself from the business in many ways. There was a analogy I heard recently. I forgot who it was exactly. I think it was the Zappos CEO, where he had said that the CEO's job is like being like a gardener in a greenhouse where you're just supposed to be like watering the plants, right, and the employees of the plants, rather than this like super top down approach. So I think at an early stage company like this, you have to build a team and then kind of put out fires, but also just like nurture everything that's going on and make sure that you're pointing the ship in the right direction. But you can't do all the work yourself at this stage.
Right. That makes a lot of sense. And what excites you most about, this work? Is it being the CEO and running this mothership? Is it the fundraising? Is it the problem that you're solving?
It's the social impact, really. I mean, every week we have something that happens where the dietitians on the front line that teach the program will share something called Wednesday Wins. And those share success stories for people that have gone through the program. So sometimes we'll hear about somebody that has lost 60 pounds and they've been able to stop taking their diabetes medication. Or we'll hear about people that improve their cholesterol, or they never thought that they would
Right.
achieve this amount of weight loss. And so ultimately, that's why we started the company. I was working in an emergency room and I saw all of these obese patients coming in with preventable death, really. And I wanted to do something about it. And now we have people that, they may have ended up in the emergency room if they had not gone through this program, or they may have developed diabetes or blindness or amputation if they didn't go through this program. And so it's rewarding to see that, idea on a napkin become a reality.
Now, was this something that you planned for a long time? Is this something that you always had within you, that you knew that you wanted to build a company and a sustainable model that is going to have a social impact? Or is this something that transitioned? Because you mentioned also, before we started this, that you actually wanted to be, go into medicine and be a doctor, right?
Yeah. So in undergrad, for the first year or so, I was exclusively focused on going to medical school. And, I was participating in research, I was volunteering in the emergency room and so forth. But the first year that I was in Boston was when Harvard opened the Harvard Innovation Lab. And that was my first exposure to entrepreneurship. Every Harvard student has also watched The Social Network. And so you get exposed to entrepreneurship that way as well. And I just started to become fascinated with entrepreneurship, and also joined an organization called the Cairo Society, which is a student-led entrepreneurial organization of really student entrepreneurs that want to improve the world. And I just realized that you didn't have to become a doctor to help people, that you could almost help more people through technology and entrepreneurship. And so, that was really thanks to the Harvard Innovation Lab, where I just realized that you could really have a large-scale social impact through business. And so I'm not a doctor, but, a lot of the doctors that we work with say that, we're having a larger scale social impact with this product than if I would have, gone to medical school. I mean, imagine if we enrolled 1 million patients into this program, we would have prevented hundreds of thousands of cases of diabetes and other preventable lifestyle related diseases. So I guess since college, I wanted to do something that has had a social impact.
Very, very cool. Now, if I were to ask you what inspires you today, and not just the problem that you're solving, which is obviously very inspirational, where do you find inspiration in your day-to-day work?
Yeah, I think that it becomes difficult to stay inspired sometimes when you're at this stage of a company, because often it becomes a lot about finance and spreadsheets and raising capital. I mean, sometimes I feel like I'm an investment banker rather than somebody who has come up with a good product idea. And so it can get very finance driven. But I think at the end of the day, it's really about hearing those frontline stories and connecting the work that I'm doing with those frontline stories, because this project is not just about money. It's about where the rubber meets the road, right? It's, a patient with a dietitian that achieves an improvement in their health. And so I think that sometimes it can get difficult to stay focused on that. But hearing those frontline stories, I think, can help keep people motivated. They're in the back office, if you will, of finance or accounting and so forth. But you really have to tie it back to the actual impact that the company's having as a whole.
And how do you then translate these frontline stories and this impact to the people working in the company? So, because obviously not every person can just go and talk to customers that are working through their own issues, right? So how do you then go and leverage this as an inspiration for the employees of your company?
Yeah, right now we're mostly a remote company that works on Slack and Basecamp. And really we've made it into this routine where every week the dietitians will publish on every Wednesday, every single Wednesday. They will publish a list of basically patient testimonials and success stories. They'll typically be about 10 every week, but we've made it really a routine where every Wednesday we can look forward to hearing about this. And if you don't make it a routine, it just becomes a bit random. But it's every Wednesday without fail. They post it to the company in a Slack channel.
Very, very cool. And if I were to ask you for 2 or 3 words that you would use to describe yourself, what would they be?
I would say resilient. I would say determination and entrepreneurial.
resilient, determination, entrepreneurial. Laurence, thank you very, very much. I appreciate your time. I appreciate your work. Thank you for the positive impact that you're making. I think that when I think through, this past year and a half, 2 years, and the companies that COVID enabled to bring and to give room to, probably 2 years ago, people would say, well, let's replace in-person groups with Zoom groups. And they would be like, no way, it's not the same experience. And today we proved that it's a scalable model that can have just as big as impact on many, many more people. And so I think that I love what you're doing, the approach of bringing in 500 physicians as investors and this idea of creating fans and customers along with investors. I think that's just really, really great. And thank you for the inspiration. Thank you for your time.